You moving on to COVID. Here we go. Wait, and a shot.
Oh yeah.
That was my one thing. I was like, maybe we put a shot at the end of the timeline so we don't
forget.
Get
the timing on this down here.
Yeah, we're getting in there. Cheers to COVID. Never ends. Okay.
Let's see how's COVID doing. I know we pretty much have beaten it, but there might be a little bit around still.
Okay. 90. There is more COVID-19 transmission today than during 96.5% of the pandemic.
So you're telling me post-pandemic we have more COVID than we did during 95% of the pandemic?
Amazing. 2,172 people who were told to go out there and live their best lives perished last week. So that stinks.
At least there's some good stuff coming out of it, like our CDC director saying we're seeing a lot of virus circulating now. She can't even say fucking COVID. There's a lot of virus out there.
Yep.
So get tested and treatment and, get vaccinated, because vaccinated means you're not going to get sick from COVID somehow. Like
it's really amazing. Doesn't mention masks, isolating, doesn't mention air, ventilation, nothing. That said, this study that came out, which, I'm vaccinated. I mean, what am I, like 6-7 times vaccinated now? I'm a walking petri dish, but it does lower the mortality rate, which is amazing, right? So oh boy, here's me putting my readers on. Okay. Yeah, I know. The very small blue bar at the bottom, the dark blue, is 30 to 45-year-olds. The orange bar is 50 to 64-year-olds. The blue is 65 to 79-year-olds. And they just say elderly for people who don't want to mention their ages.
Dying.
Elderly, right? But what they're saying, and then the one to the right of that is all ages. And what they're saying is for people who were vaccinated in October 2021, that is them on the right. That is their mortality rate on the right side of that left graph. This wasn't as easy as I thought it would be to parse. But anyway, way higher rates of death among the unvaccinated. But what they always fail to say is that, yes, I mean, death is the worst outcome, but just having COVID, it spirals into so many different issues potentially. They're now saying you're going to have to look for Parkinson's. Anybody who's had COVID, which they now I think like 90% of the whole world has Parkinson's, there's a heart condition pandemic that they're seeing is going to be happening. Yeah.
Cancer rates are going to go through the roof because of COVID. Cancer.
Yep.
Like the one thing that remember Biden's cancer moonshot? He was going to cure cancer when he became president. And meanwhile, he's literally letting a virus spread it's going to dramatically change the cancer rates in this country.
Absolutely. But luckily, your fear of cancer is outdated. The stenographers in chief, the propagandists there at the Washington Post have his back. Don't worry about the cancer moonshot. Don't worry that COVID infections lower everybody's immunity and have been tied to increased, heart conditions, infections. The RSV and flu are much worse, but also Parkinson's and cancer. So don't worry about it.
It's past TB as leading cause of infectious disease deaths. Do you remember people calling tuberculosis mild, TB outbreaks on hospital wards and in schools being ignored? Parents casually shrugging off a dose of TB in their child? That's what's happening right now. It's past TB.
And we're just raw dog in the air.
Don't wear masks.
Yeah. Go to school. Go to school even when you're sick.
Literally go to school. This is this is in Oakland, an hour and a half from me, right?
In the bluest state in the country. Yep.
The bluest. Students can now go to class even if they test positive. So I got a kid with COVID. Yeah, go to school.
I mean, we're the teachers' unions because the union leadership has really, you know, at the beginning when people first started being able to go back to work, SAG was amazing with their COVID protocols and precautions. They were really on top of it. Teachers' unions fought really hard. And now there's just total silence.
Yeah, somebody in the chat was mentioning measles. Where was it? Oops. Measles coming back.
Yep.
And it's coming back. But so this is where our the misinformation assholes are piling on. Here he is. Oh. Ashish Jha. I don't want to give him the doctor title or call him MD.
Do you know I went to college with him?
Did you really? Did you date?
No. He and Eric Garcetti were in my class at college.
Oh, tragic.
I know. Terrible.
But here he's responding to a tweet about measles being something that we should all worry about, and it's back, but he's undermining COVID with it.
At the same time, has to. Yeah. There's a lot of bad information out there about how COVID damages the immune system. No, there's actually not. There's been study after study in very highly regarded, the Lancet and, you know, scientific journals about how there is, and they all seem to really pile on, what's his name? AJ. He's a researcher who kind of called it out at the beginning that there was going to be T cell dysregulation and sort of compared it to, I know, AJ.
Keep talking. I'll just look at my chat. I'm in a group chat with him.
Yeah. He's great. And they always, you know, every chance they get to sort of either subtweet him or make, you know, little pokes at him. And he's been proven right on all of these ideas about the similarities between AIDS and COVID and their effects on your immune system. AJ, no, what's his name?
I don't know.
Oh, I thought you were looking at it. Anyway.
But then I went down a rabbit hole and I'm like, this is what happens on Twitter. It's like ADD heaven.
I know.
I'm just like bouncing all
like, ding. Anyway, thanks to anti-vaxxers, we're seeing measles outbreaks again. Encourage people to get their kids vaccinated. It's really important. Well, nobody's going to listen to you anymore because you've lied about so many things. You've been wrong about so many things. You've minimized so many things. And if your solution to COVID is just vax and relax, and then people see that everyone's dying suddenly, young people, athletes dying suddenly at very young ages, and there's no explanation that it could possibly be tied to repeated COVID infections. And instead, everyone's going to think it's just because of the vaccine, even though a lot of those sudden deaths predate the release of the vaccine. Nobody is going to trust the people in charge anymore telling you to get vaccinated, unfortunately.
Right. But the media never points out that you shouldn't trust the media. Because here's him back in 2021. I'm not aware of any fully vaccinated person asymptomatically infecting another person. I'm not saying it never happens or will never happen. It might, but it has to be stunningly rare. And that is part of the reason why CDC changed its guidance today. Stunningly rare is over half of infections are spread from asymptomatic carriers.
60%.
I'm going to stick with over half. 60%.
But also, Fauci in 2021 gave a speech talking about that. They knew it back then. We all knew. That's why, like, I didn't take off. I got vaccinated. We were so excited. I was really excited to get vaccinated. I still wore my mask indoors because I didn't know. Maybe I wouldn't come down with it, but I could still be a spreader. Like, yeah, they have destroyed any last hope of a public health, regulatory body in this country. And
no, I mean, between Fauci's bullshit, his bullshit, anyone who goes on CNN and MSNBC, they have no credibility left. these networks would not have them on if they weren't intentionally trying to propagandize us, because their track records are awful. If you look at the science, they're just failing. They're lying to the public.
They never correct themselves. They lie. I am science. Fauci is in such a world of trouble. And that's also never really covered on any of the cable news or, legacy journals. With his funding of gain of function, with his lies about it, with his insane influence to push other scientists who were very open and worried about the possibility that it spread from a lab. And he just faded from the public, but gets to be a hero to Democrats, which is, it's just another nail in the coffin of the party people think that they used to be. I don't even want to give them the benefit that they were ever.
So I will say there's a lot written out there. You just have to hunt for it on the truth. And it's starting to hit mainstream media a little bit. Laura Weiss, I'm friends with her on Twitter. She wrote an article. She's great on COVID every single day. But Democrats can't keep ignoring COVID in 2024. Her article was published. Wired Magazine, which is a tech journal, but a lot of people read Wired every day.
Yep.
There's a huge COVID surge right now, and nobody's talking about it. So the more these things get pointed out to the general public, normal people, and they see it in something like Wired, it makes a difference. So maybe we'll have something happen from it. But the problem is right now, we are going to see a decline because we were at our second biggest peak.
Yep.
And so a decline is not newsworthy. They're not going to talk about they might talk about the decline itself, but like there's no panic to be concerned, because
they're going to push that decline hard as it gets to November.
And the decline isn't like, it just dropped off. We hit 2 million cases a day, and now
we're at 1.75.
Yeah. Remember, 10,000 cases was what Fauci said. 10,000 cases a day was when we could relax on COVID.
Yeah. And we're
at 2 million. And we've never been anywhere remote. Like what's the bottom? I don't know what the bottom is, but it's nowhere near 10,000.
The valleys keep getting higher. So if you look at, every time there's a peak, it's higher. No, that's not true. The peak right now is higher than it's been, except for one other time in the whole pandemic. But the valleys never go down as low as at the beginning.
We aren't getting closer to the valleys being at 10,000.
No, and we're just letting it mutate and, spread more. So even those minor, less severe infections still end up having really catastrophic outcomes for many people, especially with the repeated infections that are happening. All right. What do you think?
I think we should move on. Public service notice. I want to show this one.
Oh, yeah.
A lot more false negatives with the tests. They're saying it takes more time generally for COVID to appear on the tests that we have. So don't trust the positive.
Like 4 days, 5 days, even after your symptoms start to show, it can take that long. So when people test when they feel they have symptoms and then it's negative, they're like, it must be something else, which I'm hearing all the time from people. No, it's not COVID. I tested. But 4 days later, so then they'll go out. Lots of people are still going out sick. Lots of people.
It doesn't really matter if you're just going to go to school with COVID anyway.
Yeah. We welcome you.
Come on to school.
We welcome you. I did just want to say, this always makes me so happy. Don't say you can't make events COVID safer. This activism action had 400 plus people engaged. Everyone wore N95 masks and tested 2 days in a row to make sure this event would be accessible to everyone. And it was a ceasefire pro-Palestine rally. But I just love that they had to wear masks and test to make everybody safe, because when you care about people, that should be across the board.
This should be a norm on the left. It's going to be a lot for a public protest outdoors to require testing and masking, but the promoters should encourage it at a minimum. And we just need more lefties recognizing look, you're not really in solidarity if you're spreading COVID and you're getting people together to spread COVID. Like that's not good for us.
Not at all.
Not to mention, I mean, obviously you should be leveraging COVID right now if you're a leftist for all the issues we want.
Yeah.
For all it points out all the inequality in our government.
Truly does. It is a working class racial issue for the world, honestly. And yep, they really have just let that go. Although I did see that, I mean, you know, everything just happens so late in the game. But Bernie is calling somebody in to talk, and I can't remember the name of this doctor, to talk about long COVID, to the help committee to talk about where we stand with that, how much we don't know, how we can't test for anything, how everything is just put under this sort of like long COVID idea. But it'd be nice if it were tied to an emergency action to give us all Medicare for all and everybody to have health care, and to bring back some of those worker protections that Biden did away with.
Yeah. How about let's start with obviously masking in hospitals everywhere nationwide. Simple, stupid, obvious. Transportation,
clean
simple,
the air,
stupid, obvious.
Yeah.
Schools, try to put forward a measure saying, I want all kids to be safe from COVID with clean air.
Yeah.
And see who votes against that.
I mean,
if you position it right, that passes, period.
Yeah. I mean, I guess the thing is the liability, right? Because it's not that expensive to clean the air. I mean, it's expensive, but it's not as expensive as, and universal paid sick leave, but it would actually prevent so many infections. Things would run more smoothly. But the problem is once they admit that it's airborne, then companies, places of business, school districts, I guess, can be held liable if then they're not keeping it up to that standard. And that's where the fight against it comes. I don't even think it's the...
I mean, I think that's a piece of it, but I think it's more symbolic than actual legally. It's because you could implement clean air protections and still not take that as an admission that COVID is dangerous.
Right.
It's just that symbolically, you'd be more aware if you're at work. Why are we putting in this new air system? Well, it's a COVID thing. It's oh, now we have to tune into COVID. Maybe I should be working from home, which the oil companies don't like because I'm not spending as much money on gas. Real estate companies don't like it because they're, the local business people own all the property in town. They don't like this.
I mean, I hear what you're saying, but I guess I do think it has more to do with liability, because the first time they do that, it'd be like saying, we're putting in air conditioning units or central air in every business. Why? Well, it's hotter now. Why? Global warming. You can make all those connections, but actually now it's so much more pleasant to go to work. The AC is on, the air is clean. I'm not sick all the time. My coworkers aren't constantly calling in sick and not being able to do their job. I do think it goes back to a liability issue, but we'll see. You might be right. I don't know that that's enough to prevent them from doing such an easy fix if it didn't come with the other repercussions of the admission that they've known now for years. I mean, they're just digging their heels in. They've known it's airborne for years.
Look, it's a mix of all of it. It's capitalism. Yeah. It's just not wanting people to recognize they could have some sort of power at work to change their situation. It's the real estate people. It's the money behind it all. It's people wanting to get reelected that are dug into their positions that can't admit capitalism exists. I mean, that COVID exists. Long COVID is real. Kids are at risk. Well, then they have to walk out all the bullshit. And we have a political system that doesn't allow mistakes, which
you double down and keep moving forward.
But it's all of it. It's just but we have to get out of this trap, because we know that COVID is mutating endlessly. They're talking about a mutation coming. I mean, the potential of a mutation, because they've seen it in rats where devastating things happen and you die immediately. And they've already been able to do that in rats. If it mutates this certain little gene thing, blah. Science,
they're actually creating that. I just saw
So, I mean, we know eventually this has the potential to mutate to something. It's awful now, but it could just sweep through the country and wipe us all out. I mean,
so if you're going to force us to live with it, clean the air. Clean the air.
Just spend a couple bucks. Put on some masks.